All right. Hello, everyone. Thank you for joining us. Hello. Thank you for
Hello.
joining us for this episode of the Data Ethics for All Live Talk. I'm your host, Shilpi Agarwal, and I'm really excited about today's discussion, which is going to be around health data privacy and protection, especially in times of crisis that we all are right now, like COVID-19. And I'm really excited to announce my guest, who is a really accomplished UX director at a risk intelligence firm called RiskIQ. He also teaches, he has written a book on data visualization called Data Insights. He teaches design, UX, and ethics courses at UX Extension Berkeley, as well as UC Davis on Coursera. Please welcome Hunter Whitney.
Hello, everybody.
Wow, that was long. That was a mouthful.
Thank you for the kind introduction. That's all. Any questions, folks? Fine.
It's like, hope I'm not forgetting anything. I had to jog my memory.
No, you're good. Perfect.
All right. So, Hunter, I know that you've been involved with the University of Toronto's Prime Initiative, right? Which is around COVID-19. Like they do other things, but it's also around COVID-19, right?
Well, actually, it's more like I work, more directly, I think, with a American Association of Precision Medicine and the task force there for COVID. So,
so tell us about that. What does it do and how did you get involved?
Yeah. So I think, well, maybe just taking a step back is I've had a long-standing interest, not to amplify this introduction, but just for clarity.
Sure.
I have a biology background. And I was in a past life a science journalist.
Oh, nice.
And I think that goes a lot into what I do now. I actually, from science journalism, I became more and more interested in communicating health and medical and scientific information to general audiences or various types of audiences. And so through my online journalism work, I ended up becoming an information interaction designer many years ago. And whenever possible, I try to work on health and medical applications. So I work for companies like Genentech and Roche and other healthcare companies, working with health data, for people who are studying it from a research level, and then also thinking about how to communicate that to general audiences. So that's sort of my longstanding interest, and I write about it in the book. I've written articles about health data, and when you talk about health data, sort of segue into it a little bit is, when you talk about it, there's two immediate things that come up, at least for me, and I think for a lot of people.
Mm-hmm.
One is, health data is extremely sensitive. It's about as personal and intimate as you can get. So, even for people who may not be so concerned about sharing other things, they can be really uncomfortable about sharing health status, STIs, or even say, positive status for COVID-19.
True.
So it's a very loaded thing when it's your health versus other types of data.
Mm-hmm.
Additionally, I think it's important to, we'll get into this in a second, I think, but there's trade-offs, because the more that we can enrich and share our own health data, the more we can get out of it, which is wonderful, right? So my goals are always to sort of enrich and get the most out of the data possible. But the flip side is, by doing that, you're also decreasing the privacy potentially, and increasing the risk of exposure or malactors.
Yeah.
It's kind of a long wind up, but and so I think those are the health data is, been a long-standing interest, and I just see the current time we're in now is kind of bringing home to a lot of people the importance of understanding data, understanding what it means, understanding the different layers of human interaction there, from medical down to political, and how those all interplay.
So now that you brought political, that's a good segue into, I just read online 2 days ago, the governor of Utah announced that they would be using a contact tracing app called Healthy Together. Have you heard about it? Are you aware? So
yes, there's a number of contact tracing apps. Yes.
Yeah, number of contact tracing apps, but this is like
Yes.
government of Utah has agreed that this is what they will be using. And we will talk about other apps and the methodologies that these apps are using. Healthy Together, as opposed to now, as we all know, Google and Facebook are also coming.
It's Google and Apple. That's actually
Google and Apple. Sorry, yeah. Google and Apple are, thank you for correcting me, are going to come out with an app in May, I think. And they have said that they've suggested some guidelines for contact tracing apps. And they say that they would be using Bluetooth technology, whereas Healthy Together app uses Bluetooth, GPS, as well as location data. And it clearly says on their website that it's beyond the boundaries that Google and Apple have set forth, but because their APIs are not out there, it's okay. It's not necessary for other app companies to follow those guidelines. So I want to talk first about what I know there's a lot of questions in this one question. So let's start with, for our viewers, what is contact tracing?
Yeah, so contact tracing is not a new idea at all. It's actually quite old. And, I guess one way to think about it is just like detective work. Right. So, it's there's a scene of the crime or a scene of the infection. So what you want to do, and it used to be and still is often done by just people walking around, shoe leather, you find out who the person who's infected has been in contact with them recently. So you can have a kind of a clear picture in hopes of where it may have spread to. Right. I mean, one of the problems we have right now with, community spread, the term has come up a number of times, I think, in the news. Yes. Is that, it's not coming from someplace else in the world. It's here, but we don't know exactly where the source is or how it's been branched out. So that's contact tracing. And, now bring in the technology side of things. Yeah. It makes a lot of sense for a lot of reasons to have more automated contact tracing with things like using your mobile devices. We all have these sort of like little reporters we're carrying around with us. Yeah. So in a way it makes sense. And also it's one less person interacting with fewer people, which is great. It's a force multiplier. So those are all the very good things, right? Yeah. Yeah. Now, I mean, I'm just going to speak generally, not particular to a particular app for the moment. I will talk about the Google-Apple partnership in a second, more detail. But yeah, one of the concerns as a UX person, as a user experience designer, is, people first of all, understanding what they're doing with the app. Like, so, they may be given an app for something and then they're not clear on what the trade-offs are. So, yes. And I also don't necessarily think that it should be the burden of the user to understand the finer points of GPS versus Bluetooth. We'll talk about them in a second. But my feeling is like a lot more needs to go into explaining what the differences are, what the ramifications are, and also understand that even if you use one system, that doesn't mean it can't somehow, there's no perfect privacy and there's no way technologically to make it perfect. There are workarounds for how to sort of de-anonymize or how to sort of remove privacy if there's enough effort and will involved. Yeah. So there's a lot to unpack here, but as far as the Bluetooth is, in a way, is an attractive technology for this in terms of privacy, because basically it's a little bit less it's less invasive in the sense that, basically it, the way this Bluetooth system works is like your phone will broadcast some, strings of numbers, or codes, and other people will sort of out there. And then if someone in your system, that you've encountered, and your Bluetooth is recorded, you encountered has COVID-19, then it will alert the people it's come in contact with. Yeah. Now, okay, so that's the Bluetooth. And then the GPS is, I think, probably people understand, more about how that works. So it's been around for a while. Yeah. And then, of course, these things can be used, Bluetooth can be used alone. If you add GPS to it, then you're automatically removing the privacy controls. Right? That, so, and the thing is, so that's where you start getting to this sort of one set of trade-offs. Another one is, well, which app do I use? Yes. From my perspective, I'm a believer in, especially in something like this, is like, well, do I use this app, or this app? Do they talk to each other? Is the type of data that they're collecting the same? Because if they're all collecting different things, then it's going to be a very mixed and maybe not as helpful set of data. So from my perspective, I would say, ideally it's like there's like, a kind of more clear pathway, and then more people can join into that one, clear pathway, or maybe it's powered, the APIs that Google, Apple will produce, a set of standard, relatively understandable apps that people can use. But I do think it's important for them to understand the differences.
Yeah. So you brought a good point. So two good points that you brought up, and I agree with those. Is like, one, we as a user, we have a lot of choices on the apps that we can use. Number two, how do we differentiate which app is the right app that we should be using? How do you, like, UX obviously plays is a very big part in how we like the look and feel, how easy it is to adopt, and all of that, and the look and feel of the app, the colors, all of that. As a UX designer, I know that these are important considerations, but also that fine print that you mentioned, right? I mean, the burden of the user knowing when I'm using this app, or even when I'm not using the app, the fact that this app is installed on my smart device, meaning that it can track this and this information, and whether it's private information using GPS exact location, using the GPS geolocation tracking, or is it anonymized area location with the Bluetooth, how much the burden should be on the user, or as a user, how can I pay attention to those things in choosing the right app for my use case?
Yeah. So, and again, a lot to unpack there. I would say, from my perspective, UX is not so much about the color choice. I mean, it's part of it, color choices and font.
True.
I always sort of joke, well, aesthetics are important. It's like, if you want an aesthetic experience, go to a museum. If you want, I mean, a lot of things, I think the most important part about it is it doing what I need it to do? Is it clear what, is this helping me? So I may have the best contact, some sort of cute contact tracing app, and it looks very simple. And I've actually played with a few of them, to be honest with you. They're very simple, which is good. They're, attractive. That's fine. But what is missing, at least for me, and I may pay more attention to a lot of people, just because, that's something I've been paying attention to for a long time.
Yeah.
But what I notice is, I don't know what this, it's very unclear what's happening with this data. There's so many questions. And I think that's another thing that I would say, I personally, I can't give prescriptions except for one, and that is ask more questions. I think that everyone, for themselves, needs to ask questions, like, who is using this data? What are the sunset provisions for this data? How is this data going to help me? Is this data going to harm me? And, I think building those kinds of answers that I think are fairly predictable for a lot of people into the UI or to the experience, right, when you're setting it up, and not give them a long, kind of agreement thing, SLAs or whatever it is, some sort of agreement that they just run through like instantly and then hit a OK. I don't think that's the answer. That's a cover your behind strategy, but that doesn't benefit the user.
Okay.
So I think, like, what you're doing is super important, is like things like this, forums like this, is creating more, raising questions in more people's minds that they should be asking, the Apples and the Googles and all these apps, like, okay, what are the sunset provisions in this? What are the third parties? Are you going to enrich this, with other kinds of data? And what does it mean for me? So even like the contact tracing, like, let's maybe take that as an example. I'm very interested myself in understanding more about what people think it does for them. Is it for them, or is it for the public health? Honestly, it's more for the public health than the individual.
Sure.
Doesn't mean it's a bad thing. It's a great thing.
Yeah.
But, it's actually more of an act of altruism, and there are some costs associated with that.
Yeah.
If that makes sense.
Go ahead.
And maybe another aspect also is, and this is something I don't think it should burden, as I always promote, is not so much on the user, It's on the producers of the thing.
Yeah.
Let them think of the questions and then answer those, anticipate those questions and answers. So even things like false positives, false negatives. So if I say I'm going to do a contact tracing app, it potentially could risk certain things for me, right?
Sure.
Like I was in contact with someone who had it, and maybe then I have to be quarantined.
Sure.
Let's say, right? There's some cost to that. But what if that person I contacted
wasn't positive? Yeah.
It wasn't positive, or was positive, but was behind a wall. I mean, they're in another place that doesn't have shared ventilation, or there's a glass, bank or whatever.
Didn't detect it.
Yeah. So I don't expect every user out there who would be participating to understand the finer points of Bluetooth and what it can and can't do. So, so I think that may not be possible to explain or understand. Even I don't know. If you ask me right now, is it like 12 feet? Where's the limit for Bluetooth?
Sure.
What material? So I think at least anticipating those things and sort of creating the right expectations in users' mind, that's really user experience, is understanding what they're doing, why they're doing it, what this is for, and the trade-offs. To me, that is user experience, and everything else is kind of the UI behind it.
True. No, absolutely agree with you. I want to take a minute here. There are a few people who have joined us live, and I want to welcome Rekha and Kapil. Rekha has also asked a question. Rekha, I've published your question in the Ask a Question section, and we will be taking questions after the 30 minutes or so after our main discussion. But keep continuing the questions. We are having a discussion with Hunter Whitney on health data privacy and protection, and especially enhanced in COVID-19 circumstances.
Yeah, there's another. I'm just looking at I think this is Rekha's question.
Yeah.
I don't know if I guess people can see
it.
it.
You can answer. I'll say start answering, so then it'll mark the video.
Yeah. So I'm just sort of skimming it here. But I think another aspect of this, which is, I think there's so many layers here. It's an incredibly interesting, tragic time, but I think there's a lot of interesting lessons, for the future about people's relationship with data. So I see something here about malicious hackers. And
so Hunter, if you could just briefly explain the question and then answer it, I think it'll be helpful for everyone.
Okay. All right. Let me take a quick look here. So the limitations of technology in terms of over-reporting, under-reporting, vulnerability to bad actors and malicious hackers, and the effect of that over long-term, most in terms of human motivation and behaviors that we will train and untrain people with. That's a great question. It's a lot to unpack there too. I think let me take the malicious actors part first, okay? Because I think we talked a little bit about the other part, maybe a little, about the underreporting and overreporting. We'll get more into that again.
Yeah.
But also, think it's important to be aware too that there's, what are the intentions, what are the potential malicious actors who might have some goal here besides just being malicious, which unfortunately is the case.
Yeah.
But this pandemic is occurring against a backdrop of a highly charged political atmosphere. I mean, I think everyone can agree with that. Everybody, regardless of your opinion. Another thing is that I think we all know at this point, or I think a lot of people know, there may be foreign interests and internal interests, both, who might be interested in exploiting the situation, right? The pandemic. This is already a known thing.
Yeah.
We've got an election coming up in November, a high stakes election.
Yes.
So, one of the things that's interesting about the contact tracing, for example, and something I've heard, a scenario I've heard a few times over, and it's quite a concern, is what if I'm a malicious actor and I want to shut down an area? Or, let's say I'm just malicious in general. I just want to shut down a park. I can maybe have a dog, run around with a cell phone attached to it. It's kind of jokingly, but I can go to different people, cover a lot of people that make contact, right, with that phone, Bluetooth, and then I say, oh, I'm COVID positive.
Yeah,
you have 10 phones you distribute.
Yeah.
Or maybe there's a certain location where you don't want people to show up to vote, right?
Yeah.
Maybe you exploit that kind of situation. So it's just a matter of imagination and level of effort to think about ways that all this data can be, kind of gamed. Again, it's not to say that this should not be done. I think it is an important adjunct. The same thing with over-reporting and under-reporting, Rika. Inevitably, it's going to be there's going to be under, for example, Bluetooth again, right? I mean, you may miss things or you may over-report things because there's 20 people behind some sort of barrier, at a glass door, and they all have COVID.
Yeah.
I'm exaggerating, but
True.
So but you have no, I guess, actual medical exposure to it. So that's going to be built in. So I think that's another part of this education is, understanding the limitations. I think I personally, I see that question. I see a question. I'll answer to Kapil in a second. But I think, I think it's really important to sort of get people to understand. So maybe I'll run to this summary. I'm not sure. It's a tough one to do a summary. It's gonna be a magic, the silver bullet. But I think it's starting to, kind of anticipate those questions and say, okay, and just more campaigns everywhere. I think that's why your organization is so important, right? Because, I think sometimes people maybe think, if they're thinking about it all, would think that's GDPR stuff or some sort of long document that I'm gonna have to agree to, and I'm not going to read. I personally, Hunter, I'm not going to read all of it. I'm just going to say yes, because that does happen. But I think it's a sort of a building. There's no one summary, but I think it's these kind of conversations. It's outreach, and maybe there's more interesting ways. Ways to. This is an interesting way, but to sort of broaden this out, to have these kind of discussions, that actually have meaningful impact on people's lives. So tomorrow, if I'm asked to, do I decide to join accept a contact tracing app? Well, if I am part of the conversation, if I have some background or understanding, then I'll be more informed,
True.
It's you don't read a book. You don't just, here's a book, read it if you haven't been taught the alphabet,
Absolutely. No, because of this, discussion and talk that we were going to have today, I had to do a lot of homework, and I learned so many more things. I wasn't aware of what all is happening in contact tracing, how many apps are there, even the government is supporting it, not supporting it. And you even talked about the sunset of these, the limitations and the guidelines of when there will be a sunset on these data collection. And so some of the apps do explicitly mention that for 30 days they would be, they will keep the data for 30 days, and then it'll be even the PI, the personal identifiable information, will be anonymized. And after 30 days, some of the information will be deleted from the app and it won't be sent. So those kind of things, I think one is that it has to be clear so that the user understands. And two is, how do we verify that what has been, again, it goes to malicious actors and the intention, of why it is being done and who is doing it. So how do we verify that what is being said is actually being implemented?
Well, that's a great, I mean, at some level you can't, right? I mean, you can and you can't. I guess I would go back to some basic heuristics for myself. You know? So maybe I'll analogize it. So I was a health journalist, science journalist in a past life. So I believe in good journalism, and I believe, sourcing matters, so, so at a basic heuristic level for myself, for trust, right? This is about trust at some level. True. You have to trust.
Absolutely.
Even if you can't necessarily, you're not going to be, if you're not a data scientist or a policy expert, even if they gave you access to everything, here's the API or whatever, can you tell what that really means?
Yes.
Probably not for the majority of people, and I'll include myself.
Absolutely.
So you got to base it in trust. And the analogy I was giving the New York Times or Washington Post do I trust the source of this article, this information? That's my kind of fundamental heuristic. So, at some level, do I trust Apple and Google more than some new startup or something I haven't heard of before? Probably. They've got skin in the game, and there's some trust. There's some things maybe I won't trust entirely, but I trust them because they're like the, known players.
Sure.
But at some level too, I think it's also important to recognize that there's no perfect safety or protection. I was talking to my colleagues at RiskIQ yesterday about this a little bit, and I have a lot of humility personally. Like, I've dealt with this. I've seen these things work. Hackers, malicious actors. I don't understand the motivation, but they're motivated and they've got time, and that's what they do, right? Yeah. And so anybody at some level, anybody, if there's a will, can be hacked, right?
Absolutely.
Or attacked. The question again is this trade-offs. So you start thinking about it like, what is my risk profile, so to speak? Yeah. How much of it, what is interesting about me as a target? What's compromising? Those are questions that, and who out there might be interested in that and might want to attack it, I mean, even having this conversation is a vulnerability in a sense, right? Because it's a challenge to who knows out there.
Yeah.
And I'm challenging anybody. But I think it's an individual level. And one other thing too is that, like, at some level, I mean, even if people say, it's a design issue. I've talked to another acquaintance of mine, who just made a company called Proximus, and looking at health metrics, and at some point they build into their dashboards that you can only drill down to, say, 50 people. If you drill down any further, which would be attractive from a health, medical, or whatever data perspective,
yeah,
that's great. But if you go a certain level, then you can start to identify. You can identify people individually, and even things like, I mean, this is already a known thing, so I'll mention it. Maybe there's perfect privacy built in, but if you have, say, your contract tracing thing powered by Google, Apple, and you've got a dedicated attacker who really doesn't like you for whatever reason, and you've got your phone and your neighborhood, maybe they can figure out, like, if they see the certain Bluetooth code pop up and they see, Ring system or whatever, they got some sort of camera on the door. They see those, they can start to correlate. Correlation attacks.
I see.
So, again, I think it's not a matter of absolutes here. It's not a matter of we can make this technology perfect and no one can get at it. It's a matter of, like, level of effort, personal tolerance for, trade-offs of risk, maybe some countermeasures, and that's, you have to go on, make those decisions based on that, knowing that at some level you can be attacked, but probably not.
I hope not. Right?
Yeah, I mean, and the risk, it's like risk, like everything in life is a risk, like, do I do this or I do this? Like, the risk of jumping off this thing is, I have a lot of fun, but I could break my arm, or leg. Now, it's, everything is a trade-off. Do I eat chocolate cake 5 times a day? I love it, but, that can be bad for my health, Same thing with this. The contact tracing may be more important than your risk that some malicious person is going to attack you. But you need to understand, like, what the benefit is to you and the risk is to you going in, I think, to really feel comfortable. And the more that I think that the providers of these things can give you that sort of clear explanation, the more that you'll trust them.
True. So I think the discussion is more along the lines of, this is a personal choice. Making this clear judgment call on, what is the amount of risk you are willing to take, what is the amount of social good you want to do, because at the end of the day, these apps are, like you said, not going to help you as an individual so much. Yes, they can point you to the nearest location, testing location, but that you can also Google and find it in other ways. If I call my medical insurance company, they'll let me know where the nearest testing center is. So it's not so much for myself, but more in terms of helping other people. If I am tested positive, who have I come in contact with, so that the app can notify all those people, they can be warned and they can take steps, do something before it gets worse.
Yeah,
right?
I mean, I want to be clear too. I mean, there's no absolutes here, and so I want to make sure too that whatever I'm saying is not against the sort of automated contact tracing. I'm a huge supporter. I think it actually absolutely needs to happen.
Yeah.
I'm all in favor of it, and I think
Absolutely.
The other way of looking at it too is, if getting philosophical for a moment, is like, if you help others, ultimately help yourself.
Sure.
It may not feel as immediate, but if the community is healthier,
Yes.
you're less likely to get sick. So, I mean, it's different orders of thinking.
Yeah.
And I don't expect users necessarily, to think of all those things, but I think it's more, almost more for the creators and people around that, the sort of ecosystem of telling people directly. I think I personally have been so moved and inspired by healthcare workers and everyone else doing this. I really have been. I mean,
yeah, really.
Yeah, I mean,
it's stories. Oh my gosh.
Yeah. So I think people, it's amazing. I mean, California is just doing a phenomenal job of kind of flattening the curve, so to speak.
Yeah, we are looking at what New York and New Jersey is going through, and oh my God, being heavily populated like California is, I think I mean,
yeah,
our governor, our mayor, they did a great job.
Yeah, and so all those things I think are important, and so my main kind of point is more for the creators of this thing.
Yes.
I mean, for people to become aware, but also to design to sort of have this in the back of your mind, to be, don't assume that people are aware of the trade-offs, or that, or that assume that people will need to learn it for themselves, because it's tough, right? So I think the more kind of clear explanation, like, again, like what you're doing in the organization, I think can become increasingly important, when it hits home for more people.
Thank you.
So by all means, I think we should do this, but I think it's just not rushing to design, rushing to build something without designing, PII, privacy by design is a term, it's privacy by design should be, built in, but also that includes explanation and, making people clear.
Hunter and I were talking about bringing a course like this for the community, of talking about privacy by design. I think that's a very important consideration for people to think when they're thinking about designing an app or an interface or a website or a product. I think having data ethics or ethics in general ingrained in the DNA of the solution that they're trying to come up with, I think is a very critical step to understand and build the whole product with having the ethics ingrained right into it.
Yeah. I mean, in some level, I mean, there is a bit of, like I was saying, like a trust us, we're Apple and Google. And in a sense that there is a truth, at least for me personally, in that. But it needs to go beyond that. I mean, if the New York Times or Washington Post does something bad, it's, or misinformation, it's probably less likely, but it doesn't mean I have complete I can just take everything there.
Yeah, blind trust. Yeah, no, I agree. I want to answer. Kapil has a question here. Do you want to take this? How do we create a layman summary of the data that are not opinion of an individual?
I'm not 100% clear on what that means, but I'll take I'll take a stab at it, I think.
Sure.
Well, I mean, I guess okay, so this is actually what I would do, is I would actually ask the question back, how do we create a layman's summary of the data? So I assume what that means is a summary for the layman to look at of their own data, I think, or
it could be.
I'm not.
Yeah. Go ahead, Hunter.
So I would say, okay, so yeah, so I guess that would be at the up, maybe they're talking about this in terms of the upfront, like what the risks are, all those things, So I think what I was saying earlier is like that, and tell me if this is, if this is not hitting it.
Yeah.
Okay, is that's only part of the answer, but like, and trust me, I've done this. This is my, my work experience over many years is the same thing. Is like, sometimes I'll come into a product, nothing to do with this, and it's very hard to use, but they'll just say at the end, here's easy to use interface. Well, it isn't, because it wasn't designed to be easy to use. And slapping on, at the end, it's easy to use, or here's this video explanation of this easy to use video and easy to use application. It's 5 minutes, that ain't gonna do it. So I actually think the most important thing is to build it in innately. I think an explanation describing the trade-offs is really helpful and fun. And I think it'd be interesting to do that exercise. We do that together sometime, maybe for a course or whatever.
Yeah.
Is design one of those initial screens that explains some of these trade-offs or considerations. I think that is fun and interesting, and I love to do that. But I don't think it begins and ends there. I think it begins with the design.
Yeah.
And it also begins with having people kind of more ambiently understand the trade-offs and what, things like false positives, that data in itself only goes so far, right? So even though all those decisions and thoughts we're making right now on COVID are based on, some data, but it's definitely, I would say, a lot of people would say it's lacking. And so, I think there's sometimes a belief, like if you've got the data, if it's put into a chart or put into some form, then that's the truth. But what sometimes doesn't happen is that it's not caveated well enough. This is the truth as we understand it now. Here are the mortality rates as we understand them now, but we don't have the denominator.
We don't have the complete information yet.
Yeah, but I wrote a book about data visualization, partly because of looking at some of these ideas, the psychology, the biases, the opinions, understanding even at a sort of a level that, for taking out the human opinions, the data alone doesn't lie, but selected data can actually lie in a sense, or
not give the full.
If you have an app that only people who are using these apps or feel comfortable with it are using, you're getting a self-selected set of data.
Sure. And then if you generalize it and say everybody in the US, this is what is going on, then that would be false information because it's only limited to the people who are using that app. So, yeah.
I mean, there's a great faith in technology. And I think people, I've seen this time and again, you show a chart. Somehow, if you show a chart and it's got some data in it, it just becomes the truth. It becomes, it's just sort of magical. People think, well, it looks scientific.
Yeah.
So I think, again, this is part of, it's like everything else. I think there's an undercurrent of education that needs to still happen. We're in a world now where data is dominant in a lot of our lives.
I think the word that comes to mind is like a camera takes a snapshot of, something happening in real time. It's like a snapshot. Same is with the data. I think that graph is a snapshot, not the ultimate truth of, what has actually happened, but it's a snapshot of based on the data that we have collected right now. This is a snapshot of what it's telling us. So that visualization is based on the data that we have today. It's not the ultimate data. It's not the, we can't generalize it and say, this is it. We know everything, right?
Probably not. I mean, at least don't assume that. And then the other thing is even this is something I teach is, how you visualize it, how you actually visualize the same data set.
Sure.
Can markedly change how people interpret it.
Yes.
So, and then, so there's, that's why I was saying data, in technology seem like they're pure and they're just very mathematical and rigorous. That's true, but it's also when humans touch anything, it becomes more complicated.
Yeah, I mean, storytelling with data is such a huge thing. You can take pieces of data and tell a story with it, which could or could not be the complete story, right?
Yeah. And going back to some political kind of discussion for a second, which is tough, but this is the world we're in now. It's coming at us from all sides. So there are people who, may have a vested interest in saying this. I'm not going to take I'm not taking a position here. I have my opinions, but I'm not going to, necessarily put them out. But let's say, yeah. But it's like there are people who say, let's get back to work. Let's go now, like all that kind of stuff. And there's not that many that, so that may be one level of taking cherry picking certain data to say this is why we should do this.
Yeah.
Maybe other people say, no, I will say this is more my camp, I'll be honest, is we need more information. We need more data to really kind of come back into any kind of, kind of more social interactions. So there's a lot of different motivations now for taking this data and turning it and twisting it.
I'm smiling because I'm in another camp. I'm also in this camp. Like, yes, we don't have all the information, but yes, we have been quarantined for so long. So if we open it up all at once, then it's probably going to be a disaster, right? So why don't we do this opening up also in phases, so that we do have enough supplies and beds in hospitals and testing kits, and there's not an overload where we can't handle it. And also for our health workers, it's not a disaster. But at the same time, if we shut down for months and then we open all at once, I think that also, again, I'm in that camp. It's my opinion again that may or may not be the right strategy.
Yeah. And there's also there's a lot to unpack. I mean, it's all important, and I think it actually does ultimately make a big difference in how people use these things. But another factor is, there's conscious bias and there's unconscious bias.
Sure.
So I teach data visualization classes things like survivorship bias.
Yes.
And I probably there's not enough time for that, but I kind of give an example out of World War II about about like how data can be collected, but then if you don't think about the data in a certain way, you're going to draw exactly the wrong conclusions. And it's not about your opinion or you're this or you're that in terms of how you identify politically. It's purely human kind of innate limitation, it's one of our mental heuristics that can lead us astray. And I think so. These are all things that are, I think need to be kind of factored in, and that doesn't mean everyone has to understand all of it. It won't ever happen. But at least think about where to deploy that.
We have one more question, Hunter. I want to ask that. Rekha asked, another issue I worry about is the possibility of third-party apps that take advantage of contact tracing functionality to surreptitiously collect data that is not really authorized and without the knowledge of user.
Yeah, that's a great question. And I ask myself that all the time. I don't have, I'll be honest, I don't have a complete answer. I can't answer that like, don't worry about it or worry about, I think you should worry about it. I think it's so case by case. And that's the problem with so many apps out there, right? Yeah. Like I actually kind of like single source of truth, so to speak, in general, or a few sources of truth, a few known licensed, certified. This is a certified one of 3 apps I can choose, not like 20. Yeah. They're all trying to do the same thing because everyone wants to help out and get involved and do things. But, I spun this app up yesterday. Everyone join in. First of all, it fragments the population. I don't know about those things. I don't know their deals. So I think things like data leakage, are really important. But again, maybe I'll kind of take it back to one personal thing again.
Okay.
And that is, so I have a fitness tracker. I'm a runner, and I really, I enjoy seeing my stats for my runs. But now it's sort of interesting because I want to see other kinds of data as well. Mm-hmm. But then as soon as you do that, you kind of say, well, how are people in my demographic looking? But that means opening myself up more, right? Yes. In theory. Yeah. And so again, it comes back to that trade-offs. Like, that data can be very helpful in your fitness and your health.
Yeah.
But there are risks. And the more you open it up and enrich data, the better it's going to be from one perspective and the worse it is from another.
True. I'm going to leave with one last question, Hunter. As an expert in UX design, I know you said you've tried a lot of apps. Is there any particular app that you like so far? Again, it's your opinion. You're not saying everybody that this is the ultimate, they need to use it. Do you like any particular app that you found has satisfied all of your requirements in contact tracing?
I'm gonna get back to you. I know a few people are working on things. Let me get back to you on that. There's some folks at Harvard, John Brownstein, for example, who are doing some interesting stuff.
But they're not. They are in stealth.
Yeah. So, but I want to be careful by answering that particular question.
Absolutely.
But if we want to circle back, maybe we, one of the things we could do is if we ever did a class, for example, is to sort of like take a look and ask some of these questions and say, how have they done a job of explaining the limitations, the strengths and weaknesses of this thing to me as a user?
Yeah. I think that's a great idea. I think let's plan on doing a workshop or a course on that. Take a few apps and see how they've explained it, how easy is it, and actually bring in users and see what is their opinion on how easy and digestible that information is for them, instead of pages that you can email yourself. Which I do
Yeah.
that. I used to only say yes without even, because it's my way or the highway. So what are you going to do? If you want to use the app, you have to say yes. Then I said, okay, at least I should have, if I'm not reading now, at least I should have a copy of what it says. So I started saying, okay, email me the agreement, which also, truthfully, I've never gone
Yeah,
back,
me too.
right? So, I mean, bite
Yeah,
size.
my view is like, get real, people. Like, the people are creating this, like, it's not just a tack on a summary, like do everything and then just throw that on as an afterthought or have people sign off. If you are serious about this, then I think we need to start building from the scratch, design from privacy from the beginning, and also think about expanding the ecosystem of understanding. It's, if you want real wins, that's the way to do it.
I love it. Love it. Thank you, Hunter, for your time. And thank you.
My pleasure.
Rekha and Kapil for joining us. I think everyone will agree that we had a very fired up discussion.
Good. I had my coffee. Right, bye, everyone. It's a pleasure. Thank you so much for inviting me. I really appreciate the opportunity.
Thank you, Hunter. Bye-bye. Oh, and I want to say, people, Hunter is also in our DataEthics4All community. He's an active member, and we can please help us continue this discussion there. And, we can have follow-ups and more conversation followed up in the community. So please join us there. Bye.
Sounds good. Okay, take care. Bye-bye.